According to findings by the World Health Organization, more than 90% of the world's 400,000 annual malaria deaths occur in sub-Saharan Africa, with children under the age of 5 accounting for 61% of all malaria deaths. Going by these statistics, the health and economic impact on the Nigerian population is quite alarming. Therefore, there is urgent need to intensify transformative strategies and tools towards reducing the malaria burden on the nation and bringing malaria-related mortality to 0%. This is Break It Down. Hello and welcome to Break It Down, where we make matters of policies, societal issues, governance and development easily understood by all. Today we are talking rolling back malaria in Nigeria. And with me is the Deputy Director, National Malaria Elimination Program, Tim Obot. You're welcome to the show.
Thank you very much, madam.
So this is Break It Down. What we do on Break It Down is we try to break every issue down to the language of the common man. So let's start from rollback malaria. What exactly do we mean when we say rollback malaria?
Well, actually, currently people use rollback malaria to mean the malaria program. Rollback malaria was an initiative of the WHO along with the UNDP, the World Bank, and the whole essence was to halve the burden of malaria in the country. And so what it did was to establish a strong partnership towards achieving this goal. So when we talk about rollback malaria, we are talking about every individual getting involved, the private sector, the government, with one aim, one sole aim of achieving a reduction in the malaria burden.
Okay, let's talk about malaria now as a disease, an ailment. Is it a disease?
Malaria is a disease. It is.
Okay, let's talk about malaria. What exactly is malaria? Because in Nigeria, almost every sickness is malaria. You say I have headache, you say go and treat malaria. Anything, they say go and treat malaria. Yeah,
I think that's one of the problems that we have now. A lot of sicknesses present with fever. And the problem is when people have fever, the next thing they think of is that we have malaria. Even stress can give you fever. You can feel feverish in the morning or in the evening if you are stressed. And a lot of other diseases, and I don't want to mention coronavirus, have the symptom of fever. So not every fever is malaria. Okay. So if you get fever, the best thing to do, what we encourage people to do, is to go to the hospital and then you'll be tested. And if you are positive, then that means you have malaria, and then you're given the necessary medication. Okay.
Let's look at malaria, how it spreads. How does it spread?
Well, simple. Malaria, you get malaria from a bite, from an infected Anopheles mosquito. Yeah. So as long as mosquitoes are around and they are infected, then, and they bite, any individual, that's how malaria is spread. If the vector is prevented from getting in contact with us, then we cannot.
How do we reduce the spread? I had a friend who used to say, don't fight the malaria, fight the mosquito. How do we prevent malaria from spreading? Yeah,
so for the national program, we have a lot of methods that we brought out to help people, protect people from the malaria, the vector, which is a mosquito. Now, one of them is the use of net. I'm sure you know us for that.
Yes.
And so, after a period of 4 years, we distribute nets to all Nigerians. And then the whole essence is that after a period of time, the chemical, the insecticide that is in the net reduces in its potency. So you need to share or circulate or distribute another set of nets, which is what we do regularly. And so if you sleep inside the net and you tuck it well under your bed, under your mattress, and there's no space for the mosquito to get in, then you cannot be bitten. And what happens is that if the mosquito perches on the net, then it dies because it gets in contact with the insecticide and cannot survive. So that's what happened. That's one of it. The second thing, the method of doing that is by ensuring that we do IRS, indoor residual spray. Now, what you do in that is to spray the inner walls of a house. And so if any mosquito, you know, normally when mosquitoes feed, they will want to perch on the wall to rest. So they will just get in contact with the insecticide that has been sprayed on the wall. It's not injurious. Once the wall has been sprayed for 6 months, any mosquito that perches on it dies. So we encourage that.
Is it a special kind of spray, or is it the normal?
It's not the insecticide we buy in the market. You need to have a set of spraymen. You need to have, they will come in, they have been specially trained, and they come in with the chemicals and mix them and use them to spray on the walls. Right. It doesn't dirty the wall.
Does it mean if they spray a community, for example, it will also
it will reduce the burden?
The spray will be there for a while?
Yes, for 6 months, anywhere that is sprayed. That was done in Lagos, in some parts of Lagos, and I was there too to witness it. I will mention another way again that we can deal with the vector, which is larviciding. But larviciding is not encouraged in a place like Nigeria, where you cannot map the water bodies, because you need to map them. In larviciding, you put the pellet into water, and then as the larva perches on it, then it dies. It eats the pellets and dies. So what happens is that for us, we have a lot of unmapped water bodies all over the place. So it becomes difficult to actually quantify the size and also the quantity of the pellets of the larvicide that will go into that. And then also, to keep the mosquito away, we can screen our houses, have nets on our windows, have nets on the doors to protect us. Let me mention too that one of the things too that we are not doing too well has to do with environmental management. In fact, the kind of things we see now of people piling filth behind their homes, in front of their houses, inside the gutter, and so on. Those fields create a breeding ground for mosquitoes. And so those are things we need to do. We need to take the management of our environment very seriously. We need to clean our environment and ensure that things like tires serve as very wonderful breeding grounds for mosquitoes, because water can accumulate there and then provide a breeding ground. So we need to keep our environment very clean. We need to go back to those principles so that we don't provide a space for the vector to continue to increase in number. Well, the vector is a mosquito that brings the malaria to us. Yes.
We've been on this malaria thing for like forever, since I was born. And I'm over 50, well over 50 now. And we're still talking malaria. Why is this the case? Is there nobody doing some kind of advanced research on malaria?
There is a lot of research that is going on, but let me encourage us first that is doable. We can have a malaria-free nation. If you look around in the African region, because I don't want to go too far, so we don't think, well, it's a Igbo and all that. But in the African region, we can certainly do things that will reduce the burden of malaria and totally eliminate it. Let me give you some countries that have achieved that. Algeria, for instance, has achieved that. Lesotho has achieved that. Mauritius has achieved that. Seychelles and the La Réunion, which is a French colony, but in Africa, have also achieved that.
How exactly?
Well, the same methods. Well, some of the others the developed worlds had to use spray chemicals all over space. But for these other ones, the methods that we are using in Nigeria, the same methods. The first thing that we are talking about is also to take care of our environment and ensure that it doesn't become a breeding space. The second thing is for us to stay inside the net and limit as much as possible the contact between us and the mosquito, the infected mosquito anyway. And then the third thing we are to do is that once we are sick, once you are sick, there is no need staying in the house. Go to the hospital. And part of what people do is to go to the wrong places or to take the wrong things. Somebody is sick, has a fever, he has not even gone to the hospitals to test. He stays in his house and mixes all kinds of things to take. You are not a doctor. So please, there are people who have been trained to do that for you. Go to the hospital. One thing that will happen first is that you'll be tested. There are ways of knowing that you have malaria through either you use the microscope or you use the RDT, the rapid diagnosis test. It is a kit, and then it has you mix. Once you drop the blood there, 10 to 15 minutes, you will know whether it's positive or negative. So it doesn't take time. It's better, or well, it's faster, not better, than the microscope, in the sense that you don't have to go home and come back or do what. Once you are there, 10, 15 minutes, it's done.
And they're not going to draw your blood. I think
they will draw your blood. They will take.
They draw the blood.
Yes, but
there's one they just prick your.
That's the one.
Finger.
So it's a little quantity, not much, and just drop it on the cassette, and within 10 to 15 minutes, it's done. So you will know your status. You know that, okay, I have malaria. And then the next thing is, what do I do? The next thing is for you to be treated with an ACT, artemisinin combination therapy, ACT. That's what is recommended. And you know, one thing in the program that is done is that annually tests are carried out to see whether those the ACT is still potent, and a set of them, you know, drugs are still potent to be used for malaria. And we had the last one, the one of last year. The results have been shared. The ACT is still the most potent for treating malaria. So we need to avail ourselves of that opportunity. Also, for pregnant women, we also encourage pregnant women to go to the hospital during their ANC and ensure that they take SPs, sulfadoxine, pyrimethamine, medicine, which is what is given, the SP. And then
that is to prevent.
To prevent, yes. And then, of course, what we are doing now up north, in the Sahel region, is to give children, because they don't have a long period of rain like in the south. But in that short period, it's heavy, and then already it serves as water collects in different points and serves as a breeding ground for mosquitoes. So what we do is, for children under 5, we do what we call seasonal chemoprevention. So they are given tablets to take ahead of the rainy season. So that protects our children, keeps them alive during that period. So that's part of what we are doing.
Let's take a break now. When we come back, we'll be talking about resistant malaria.
Thank you.
I have had resistant malaria before, and I know what it is like. We'll be back. We're still talking rolling back malaria in Nigeria.
Trending and current issues.
The COVID-19 vaccine is a blessing from my own point of view.
NGOs have a role to play.
Government policies.
Would you agree that the government is proactive enough? I think they are. What is your opinion?
We need to do more.
The training of women
Goes beyond rhetorics of government and concrete action.
NGO welfare programs that directly affect the average Nigerian home and the common man in the language that is easily understood by all.
It doesn't matter that the legislative arm and the executive arm should be at loggerhead to show that there's checks and balances.
Where is the checks and balances, they ask?
Every Wednesday at 6:30 p.m. on this station.
You're still on Break It Down, and we're still discussing rolling back malaria in Nigeria. And we are still with Tim Obot, Deputy Director, National Malaria Elimination Program. We were discussing the under 5s who are the most susceptible and where we have the higher mortality rate according to research. What advice do you have for parents who have children who are within that age group?
In fact, my advice will be for those who are living in the Sahel region where we are doing seasonal malaria chemoprevention. They should they ensure that their children are given the tablets to take during the season. And this is the time that a lot of those activities are going on. Please don't allow your child to miss it. They should take that medicine. It will protect them throughout the period, the rainy seasons. And then for those of us in the South, once a child is feverish, please take the child to a PHC. And I need to add that the drugs that are given in PHCs are free. The nets we distribute.
Okay, PHC is primary health.
Primary health care, yes,
okay.
Yes. Primary health care center. So they are free. The malaria medicines we give, as well as the malaria nets, the nets that we give to prevent our people from getting malaria, are all free. They are given free. So go to the hospital, you'll be given a free medicine to
and
take.
Free nets.
Yes, I must qualify that. Free nets are given to pregnant women and children under 5. But for adults, you will have nets during the mass distribution. And then during that period, we expect that you'll be able to manage your net well and then use it till the next
Some people
distribution.
find the net very uncomfortable because of the heat, especially when there's no electricity.
I totally agree with you, but you can also notice too that a lot of homes are having generator now.
Yes.
So you could direct your fans towards the net. In fact, that's what I was sharing with somebody. I said, the best thing would be let's direct your fans towards the net so that it could still be blowing on you instead of you staying outside. You know, some people sleep with just their pants and they are exposed to the mosquito, you know, for the 8 to 10 hours of the night. And that's not too good for us.
Yeah, let's look at resistant malaria.
Yes.
What's to be done? What's responsible for resistant malaria?
Okay, the first place, I think in most of the cases, what happens is that I'm not a medical doctor, they will be able to explain better. But what happens is that a lot of people take the malaria drugs without completing it. I've seen cases where people begin, you know, the drugs come sometimes in 24 tablets and so on and so forth. And then when they have taken the tablets for maybe the first day and they are no more feeling feverish, they stop. So when you do that, your body begins to develop resistance against the drug and all that. So that becomes a problem because you may do that the first time and say, well, I'm just fine, I'm going. And then you do it the second time. And then you find out that the next time you're taking that treatment, it does not respond. So what we encourage people to do is where you notice that you are having resistant malaria, please, resistance to the drugs, please go to the hospital. They will be able to treat you because the arrangement is such that normal, in quote, malaria is treated in the PHCs, but severe malaria is treated in the hospitals because sometimes it could be adverse and you may require things like oxygen and so on and so forth. So we will prefer that you are treated in the hospital where the quality of care is higher and we are sure that you'll be safe there.
Wow. Okay. You mean malaria can put you into...
Oh, sure. Severe malaria can kill.
Instead?
Severe malaria can kill. Sometimes people have cerebral malaria and it's as if they are getting crazy and all kinds of things. It's not as simple as we think. I think that part of the challenge is that we are not doing post-mortem for people who die on very common basis. You know, like if you die in the village, nothing is done, you know, to check by way of post-mortem to be sure what killed the person. And a lot of assumptions will cover that up, and people, all kinds of accusations. But when we begin to do that, you'll see that a lot of people are dying because of malaria. Last year,
you have statistics?
Last year, from the data we got, it was estimated that 9 people die per hour from malaria. This year, one of the calculations is that it has grown to 11.
Wow.
11 people dying. But this could have been prevented if we used the nets that are available, if we went to the hospital when we felt feverish and so on. We could have prevented that.
So how effective is the malaria control policy of government?
The program is successful, but we have not reached the place that we should be. If you check, the prevalence has been reducing. Prevalence used to be 42%, okay? But that has reduced to 27%, and currently 2018 NDHS is 23%. So that is still going down. That's not where we want to be. We want to get to a situation where Nigerians are free from malaria, where the burden is reduced considerably.
Is that realizable at all?
It is realizable. A free malaria is a long-term goal, but we have a new malaria strategic plan with all kinds of strategies, 5 strategies that we are implementing, and we hope to achieve a 10% prevalence by 2025, 10%, and then reduction of deaths to 25 per 1,000 live births by 2025. So we are really, working towards that. What we are also looking at is we've seen that government resources will not be enough. Let me tell you, and I don't want to scare you, that it will take us 1.98 trillion naira to implement that plan in a 5-year period. That's huge. So we need both the support that is coming from outside the country. We need the support from government. In fact, we are canvassing that support from states and LGAs be increased. We're also looking at the private sector coming in to help. For other places that have had success in their malaria program, we had the private sector playing a very considerable role, So we don't have to leave it in the hand, it's ourselves. So we don't have to leave it in the hand of government alone, because government has too many things to cater for. So we appeal to the private sector, to all kinds of rich people who are doing well in the country to come in and support the malaria program. What we are talking about is not you bringing money to us, but if you pick an intervention and say, well, I'm going to ensure that this intervention is carried out in so area, we will support you, we'll bring all the technical support to you and ensure that that works. Okay,
we have the Billionaire Network who is doing a lot right now, commendably.
Yes.
Is he working with you?
Yes, he's partnering.
Okay.
He played also a significant role during our World Malaria Day in terms of creating awareness and all that. There's still room. We want to collaborate more in terms of the actual strategy. We have a malaria strategic plan that is available. So we are waiting, and we are also talking together. They have representatives in our technical working group. So we are doing that. And it's open to any other billionaire and any other person or company that is interested in ensuring that the burden of malaria is reduced.
And the politicians,
what are they doing? Especially
like the nurse.
Seriously. So we need everybody. We need everybody. This is how we can reduce it.
So what about individual responsibility? Are you responsible to yourself to make sure you do not contact malaria?
That is important. That is important. Yeah. And for an average Nigerian can afford to buy a net. Yeah. You can afford to screen your windows and screen your doors. You see the metal nets that are put on the window. So we appeal to you, please do that. If you don't buy drinks and some other things, you could save that money and screen your window. And even for the love of our children, that cannot really withstand this, and our pregnant women, and we don't want to lose them again. So that's why we are appealing to everybody.
Thank you very much.
Thank you so much, man.
Malaria concerns everybody. I know what I went through as a mother, and even now that they're grown up, we still have malaria sometimes.
That's true.
It can be terrible sometimes.
That's true.
Thank you for being on the show.
Thank you
for
so much.
enlightening us. We've been really, really enlightened.
Thank you so much.
Thanks for watching the show today. We discussed rolling back malaria in Nigeria, and we had Tim Obot, Deputy Director, National Malaria Elimination Program. This is Break It Down.